Hello guys, welcome back to my YouTube channel. So after a long and hard research, I was trying to find if there is any alternative ways that you can get into the US as a nurse without going to the NCLEX. I came across this amazing opportunity where it gives international nurses a chance to get access into the US healthcare system without having to get the NCLEX done. So you can be a nurse in the US without an NCLEX. So in this video, I'm going to explain how this program works, what benefits you gain from this program, and then I'll take you through step-by-step guide on how to apply and gain entry into this program. If you're interested, just stay tuned, but don't forget to subscribe to my YouTube channel. So this program is called the US Observership Program. So the US Observership Program is a short supervised hospital placement where international nurses get the chance to work alongside experienced US nurses in an actual ward. So you will basically be shadowing these experienced nurses, watching what they do. You get access to patients' records, you get access to handovers, clinical meetings, clinical discussions, specialized procedures, and get in touch with consultants and specialists. However, this program doesn't allow you to touch or treat any patient, but it's actually a way to get an immense experience. So let's say you're preparing to take your NCLEX. This program is going to give you the chance to actually understand the US workflow. You will get to see firsthand how certain procedures are being done, how delegations are being done in an actual ward setting, and get the chance to see all these advanced equipments and these modern facilities, specialized procedures, which you might not see or have any experience with in your own country. So this way, even if you want to write your NCLEX after this observership program, you have actually had the experience, seen how things are done. So it makes it a bit more easier to understand and then know what to do during your NCLEX. This program also shows the US employers and the recruiters that you are actually serious and you're familiar with the US health system. It will improve your clinical English and communication skills. It's going to help you build relationships and contacts and even references for your CV. However, if you have done your NCLEX already, you can still enroll in this program because this program is going to give you an actual exposure even before you go into the US and start working. And sometimes too, employers will hesitate a bit in giving you a job offer because you don't have any US experience, especially in these times where immigration is getting tougher and tougher. However, if you have experience from this program, it gives you an edge, even helps set you up for better employment terms, because contract terms are normally based on what experience you have and how beneficial you will be to the team or to the employer. So if you're interested in enrolling in this observership program, I'm going to take you through the step-by-step guide on how you're going to apply and gain entry into this program. So note that not all US hospitals offer this observership program, but some of them that offer are Cleveland Clinic, Johns Hopkins Hospital, Mount Sinai Hospital, Washington Adventist Hospital, and a few others. Some of the hospitals might not actually list it on their website, but if you do email the nursing education department, they can give you more details and how to apply for it. I also have a link in the description for my Telegram channel. If you're interested, you can join if you want any guidance on how to apply for the observership program. So now the main question is, how do I actually apply and what are the requirements? So before you actually decide to apply and get into this program, you make sure that you have your professional CV updated. You also would need to write a personal statement stating why you intend to enroll in this program and what you aim to benefit from it. I'll be leaving a copy of a personal statement in the Telegram channel for guide as well. So when you are ready to apply, you need to email the nursing education department of the particular hospital you want to enroll with. After emailing them and submitting your CV, your statement of intent, you need to wait for them to send you back an acceptance letter, which could take about 2 to 6 weeks depending on when the program actually begins. So after receiving your acceptance letter, you can apply for a B1 or B2 visa, which is a business or tourist visa, because this program is actually an unpaid program and it's a non-hands-on work, so you don't need to apply for a work visa. So with the visa application, you will need to provide an invitation letter which will be sent to you from the hospital, an observership acceptance confirmation letter which will be sent from the hospital as well, and then you need to state the purpose of your visa, which is educational medical observation observership with no patient contact. I don't want to make the video so long, so if you want a step-by-step guide on how to apply for the B1 visa, I have another video that's more detailed on the visa application. There is a link in the description that you can access this video from. So let's talk about the cost involved in the US nursing observership program. Some of these programs are free, but they are very rare, and most of the time it is usually by referral. Averagely, most of them would range from $500 to $3,500 depending on the reputation of the hospital, the length of observership program. Some people choose to do it for a month or two, which is more affordable. The location also matters a lot, because if you want to do the program in, let's say, a state like California or New York, then it's definitely going to cost more. You also need to cover your travel expenses, your accommodation, food, and basic transport. So you kind of need to prepare like going for a tour or a business trip, but this time you're actually going to get something more valuable from it. So even if you're already licensed, it will help you to bridge the gap. And if you're still preparing for your NCLEX, this is going to give you more confidence and clarity and give you an actual experience on how the work is, done in the real world, so that your learning and then analyzing of questions will be much easier for you. Like and comment if you want a step-by-step guide on how to actually apply to specific hospitals, or step-by-step guide of applying for a B1 visa for this observership program. Thank you very much for watching the video, and don't forget to subscribe to my YouTube channel. See you later.